Guys, I wanted to post a video on Kybella of the knees, knee fat, Kybella of the Kybella of the back fat, Kybella of the axilla or the armpit fat. And I get these questions all the time, like how do you do it? What dose do you use? Do you reconstitute it? And the rule is all of this is off label, just like when you use Voluma in the temple, that's off label, right? But we still do it because we know the rheology of the product. So the rheology of Kybella, it's deoxycholic acid. So when you inject it into the area, it basically takes that fat cell and it blows it up. So when you have that, when you have apoptosis, you have inflammation, what does inflammation cause? A rush of neutrophils, a rush of white blood cells, a rush of inflammation, and macrophages to kind of eat away that cell. When you have that, what do you have? It's like a cellulitis. Basically, you have redness and inflammation and warmth. So you really don't want to apply ice at all. When you're using Kybella outside the FDA approved area, the submental fat, you have to be honest with your patient and say, hey, this isn't studied, meaning we don't know the efficacy of Kybella in this area. Does it work? Absolutely. How well it will work, we don't know because it hasn't been studied. This has been studied extensively. Allergan's working on submental or on axilla fat, working on inner thigh fat, but we don't know the truth. We don't know how many when you do anywhere off label, axilla, knees, just also use common sense. Like I'm taking deoxycholic acid to this area. Are they undergoing breast cancer treatments? Not a candidate. Do they already have lymphadenopathy? Oh my God, there's the biggest cricket I've ever seen. If you guys see, oh my God, okay, getting off topic. So you have to make sure, just use your common sense. Are they undergoing surgery, mastectomy, breast, like you have to use your common sense. Just like on the face when you would not inject, you have to do the same thing for the body part. I do not mix my Kybella with lidocaine at all. I don't mix it at all. I don't use the grid. The grid is helpful, or I just like to draw. The grid is hard to get on and it's hard to get off. So I'm going to show the knee one, but use the same principles from submental that you go into knee. Small areas, one vial is about a quarter size of fat dissolved. So usually the amounts that I can list below, it's 2 vials Kybella or 2 vials submental you should start with. Again, FDA usually says like you start with 3, but financially that's really hard. We charge $6.50 a vial. Start 2 here, usually armpit fat. I do 1 each side. Inner thigh fat, same 1 each side. Bra fat, same thing. And then if someone has a lot of fat, you have to have the come to Jesus talk. Best thing for you is liposuction. We're happy to use deoxycholic acid. Are you going to see a big improvement? No. Are you going to see minimal improvement? Yes. If you are morbidly obese, you will see a very minimal improvement. And that's like, I give my patients that option. I tell them like, listen, the best thing for you is liposuction. If you don't want to undergo the knife, I'm happy to do this procedure for you, but you have to understand it's going to take off literally 2 millimeters of fat. For someone that's thin, that's a game changer. Someone that is morbidly obese, that's not a game changer. So be very honest with them, because when people are unhappy with Kybella results, oops, it cut off. When people are unhappy with Kybella, it's because they weren't given the come to Jesus talk and said, like when you actually see those results from Allergan and you see the significant difference, it's so many treatments and so many vials. So I say usually about 1 millimeter per vial. So I'm very, very honest. I show them with my hands how little it is, but how it's impactful. So now here I'm marking my patient. I'm using a white marker pen you can get from Amazon. It's like $1. And I talk with my patient. I'm like, hey, where are we targeting? I want to make sure we're on the same page. And she is very happy with the selection. And see how small the area is? I'm taking my fingers and I'm pinching it up. I'm making sure that I can pinch up, because if you can't pinch up, that means it's just skin. So if someone with loose skin, this is not going to work on. Someone that's above the age of 65, probably not going to work on. But see, I'm pinching and showing her that small, see that small little square? It's probably 2 inches by 2 inches. And then she's getting up and she's showing me her flanks. And this is the area. And see how big of the area she's grabbing? She's like, I hate all of this. Well, girlfriend, come to Jesus talk. Kybella's not getting rid of all of that. You're beautiful the way you are. And I'm very honest, because I don't
I don't like, no one likes that skinniness. We like a little curves now and then, right? And I explain that to my patient. I make my patient feel good. And then I show her the small little square. And then literally I will take a picture. I'll mark the area. See that little square I'm drawing out. And then I will take a picture of it and show the patient, like, see this little area. This little area will be red. It'll feel numb to the touch. It'll be a little bruising, but that's a small area. And in that area, only 1 millimeter of fat is coming off. And she's a pretty, she's an in-shape patient. So for her, that might be all she needs. She might not want any more of that, but it's good to show, like, so if you're doing 6 treatments, 6 millimeters is a lot of fat. But that's 6 treatments and it's expensive. And at the end of the day, if you calculate that up, that's going to be the same amount as lipo. So this is a big part. This is the biggest part of the procedure in my mind, is sitting down, talking to the patient, and then marking the areas with a white marking pen. You can use the grid to space out. If you don't use the grid, the way I space out my injection points, so it should be like a finger breath. It's 0.2 mLs each injection, and then I space it out 1 finger breath. The issue with doing too much too close together is skin necrosis, because what is Kybella? Like, use common sense. It's deoxycholic acid. And then she shows me her stomach, and I was like, nope, not doing it. Too much today. We're only doing the flanks, the knees, and the inner thighs.
The way I like to inject
marking
Kybella
is
to
thing.
grab the
area.
area.
Show you how I do it.
So I literally have mine. I use a 3 ml syringe, and it's 0.2. So it's 2 little hash marks. And see how I grab the skin? It feels better. I go in right above my little mark, and I do 0.2 ml, so it's 2 little hash marks, and I space them out about 1 inch, and I go down and I march down in a line. I'm not sporadic about it. I'm very calculated with my injection points. And you can see how I go in, and I'm pulling everything away. So you want to pull the fat away from the nerve. That's the biggest thing. And you could see how small the area is. That's just 1 vial right there, because that's what her budget was 1 vial. So 1 vial, 0.2 ml, so you take 10 times 0.2, so 5 injection points. And then same thing here. I'm pulling the fat away from the structure. You don't want to inject in the muscle. You don't want to inject in veins. It demyelates things. So you don't want to inject on nerves. And I'm pulling and pinching up, and it feels better for the patient too. I don't know if you've ever had like back in the olden days, we for shots, we'd kind of pull up. Feels better. And you can see it go straight in. I'm using a 30 gauge needle. 30 gauge 1/2 inch needle, and you can buy them from McKesson, and then just slowly, Kybella, you don't want to take your time with. You want to be safe about it. You don't want to just throw it in there, but it's burned, so you want to go pretty quick. And so I'm doing 0.2, and I already did her knees. And then now to do her flanks, I kind of turn her around and have her sit on the bed. I think this is the best way to do it. And oh, don't laugh, Hanya. Well, this is a serious matter. So I like to leave the bra on because it kind of shows exactly where that bra fat is. And then you see, again, I'm grabbing, holding, and I'm going 0.2, an inch over, 0.2, an inch over, 0.2. I'm sorry, you can see I was literally using my tripod to hold this, 0.2 over. So hopefully this video helped you out. You can text me with any questions or comment below. Have a great day.